be any discussion at home about tablets every day.
Yeah.
So it's the same medication, but just given in a different form.
Right.
And I think the most important thing for you at the moment is to feel that you have some control over your life.
Definitely. I want to feel like that. Maybe my mum won't let me take the tablets. She talks about it all the time. It's just all I hear about is the tablets. I know.
So if we were to remove the tablets from the equation completely, you would have an injection once a fortnight, and you could decide whether or not you have the injection. Your mum can't give you the injection, the nurse has to give you the injection.
Right.
So that would be your decision, and you would be deciding whether you have it and whether you control your illness with that type of medication.
Yeah.
I mean, there's a possibility that then your interactions at home could change and they could be more about things that you want to talk about rather than medication.
Yeah. Well, I want that. That's what I want.
Gerard, or Jed as he likes to be known, is 24. He describes a chaotic childhood. He is the middle of 7 children. His father left home when he was 5, and his mother took a new partner who drank alcohol heavily. He played truant from school, and by the time he left school, had spent 2 periods in youth offender institutions for theft. Jed has schizophrenia. He first came to the attention of psychiatric services at the age of 19, although may have had symptoms for a year before that. He was referred to psychiatry after setting fire to a newsagent when he had been using cannabis and amphetamines. He was referred to mental health services by the courts. Jed's symptoms involve a complex delusional system involving newspapers, where he feels he is the subject of articles written on a daily basis. He has third-person auditory hallucinations, where he hears journalists discussing him and his life. When unwell, his thinking becomes tangential and difficult to understand. Jed has done well with treatment with atypical antipsychotic medication. However, after discharge from hospital, he often defaults on medication and starts to use illicit drugs. In this programme, I am going to talk to Jed about how I might be able to empower him to take control of his treatment and improve his adherence with prescribed medication. Jed, what do you see as your main difficulties at the present time?
I know I have an illness, but I don't really like to think of it as an illness. I just think of it as a problem. I mean, everyone has problems, don't they? So
What bothers you the most?
when I think that people are writing things about me in the papers, things like that.
What do you think has caused your problems?
Well, I know it's made worse by smoking cannabis and other drugs.
Has anyone suggested an explanation to you?
The nurses have told us some things and tried to explain it.
What have they said?
They said that I've got an illness and that I need to take my medication to make me feel better.
And how long do you think this illness will last?
I know it's going to last a long time.
Is there anything that you or anyone else can do about this?
I know if I take my medication when I leave, then I'll be better. Then that's what everyone tells me.
How has the illness affected you, would you say?
People think I'm strange, don't think I'm normal, so I don't have as many friends as normal people would have. I don't know, I get edgy, I feel strange around some people.
What have you done to try and control this?
Well, I've got my job. When I work hard, I feel better. I feel better if I work hard.
What has helped?
I know this sounds stupid because I'm here because I haven't been taking my medication, but When I take my medication, I do feel better. When I've got someone to talk to, I feel better.
What do you think's not helped you?
Hanging around with my friends. They take a lot of drugs, and when I'm with them, I want to take drugs too.
What was the first thing that you did to try and control the problem?
Well, at first, smoking cannabis really helped. Made me stop thinking about the things that were going on in my head.
So how effective was that?
Probably not very effective.
Did you do anything else?
Took other drugs as well.
And how effective was that?
Not very effective at all, really. It was 10 times worse after I'd taken stuff like amphetamines and ecstasy. The next day I'd feel really bad.
So what could you do differently next time?
Well, when I leave, I always intend to take the drugs. I honestly do.
You said at the beginning that you have this illness. Do you know anything about the treatment of schizophrenia?
I know that I've got to lead a healthy lifestyle and work hard and take my meds.
And what happens when you don't take the medication?
I feel paranoid. I think people write stuff about us in the newspapers.
And then when you take the medication again after that, what happens?
I feel better for a while. But then it's just a constant reminder that I'm not the same as everyone else.
Yeah. You've ended up in hospital a number of times, haven't you, Jed?
Yeah.
And what's caused that, do you think?
Probably taking street drugs and not taking my medication.
One of the things in schizophrenia is that the medication is one of the forms of treatment. There are others, like you said, getting a job and having a life. But if you don't take the medication all of the time, you become ill. And the difficulty is each time you become ill, it's more difficult to completely recover. Would you say that's happened to you?
Yes.
With regard to the treatment, how long do you have to take it for?
Probably forever.
Do you ever try and cope without your tablets?
Yeah. I just want to be like normal people.
Are there some times when it's more difficult to take your medication than others?
Yeah. My friends laugh at me about it. It does just make me feel like I'm not one of them, so I try and don't want to take it around them.
So how does taking tablets actually fit in with your lifestyle?
Not great, not well.
What do you think about injections?
Don't want injections. I hate them. When I first came in, they pinned me down and give me injections. I don't want that happening.
That was when you went into hospital when you were unwell. Just think about it for a moment. If it was an injection that you chose to have, so not like the ones that you had in hospital, once every 2 weeks, you could have it away from home. Your friends need never know that you're on an injection. And I wonder if that would help you take the medication as you say you want to.
Right.
We hope you found this programme interesting and useful, and that it's given you some ideas of how to introduce long-acting injectable medication into your practice. The patients played in the programme were actors, and the interviews themselves were necessarily brief to demonstrate the techniques and don't represent a true psychiatric interview.